Hi, my name is Arun Murugesan. I'm going to be a senior at North Royalton High School next year. And the title of my project was the analysis and study of turnover time in the operating room. A big question that must be answered before I go any further with this is, what is turnover time? Now, turnover time usually means the time from one patient leaving the operating room to the next patient entering the OR. This is the most generic definition, as the term can be defined many ways based on whose perspective is being viewed. Other turnover time definitions. So, as I mentioned before, the first definition that I stated was generic. It depends. For anesthesiologists, turnover time usually means the time a patient is transported to PACU and given a report to the next patient's anesthetic induction. For surgeons, turnover time means the time from the closure of one patient's wound to the next patient's incision. Now, for this presentation and for the data that I collected, and I'll explain, the definition is the first one, the generic one. Why it's important. Turnover time represents lost revenue generating opportunity for the surgeon as well as the hospital and anesthesiologist. Improving turnover time is a major opportunity to increase personal productivity, efficiency, and most importantly, optimize the hospital's income. So I had two objectives for this study. The first was to identify issues causing inefficient turnover times, and the second, to make appropriate changes to increase efficiency. My hypothesis was that turnover time is dependent on the complexity of the procedure, which can be improved by a holistic review of the entire process and appropriate changes. Now, I studied 5 doctors, and these were the 5 most frequent doctors at the Strongsville Family Health Center. As you can see, their areas of specialty varied, and the invasiveness of these procedures varied just along with their areas of specialty. For example, orthopedic surgery by Dr. Scarcella was definitely more invasive than pain management by Dr. Grimm. So, as you'll see, that definitely plays a role in the total time and eventually the turnover time. Now, the average total time, it also goes along with the invasiveness of the procedure. So, as I mentioned before, Dr. Scarcella had the highest total time with 63 minutes, and Dr. Grimm had a total time of about 12 minutes. And it's also important to note here that Dr. Kosmorski, even though it says 26 minutes on this table, his total time, it could be a viable number if you divided that by 2 and said 13, because Dr. Kosmorski oftentimes had 2 operating rooms running at the same time. So, now the average turnover time. So the total time is goes along again with the turnover time here. Dr. Grimm had his surgeries weren't very invasive, so his average turnover time was only about 3 minutes, whereas Dr. Scarcella had a turnover time of about 19. Now, if you look at Dr. Kosmorski, as I mentioned before, you could safely divide that 13.7 rounded to 14 and get 7 minutes for his turnover time, and that would be a very viable number again. So the correlation here was Dr. Scarcella. If you look on the graphs, he had the most invasive procedures, and he had the highest turnover time, as you can see indicated in the light blue. And Dr. Grimm had the least invasive procedures, and you can see that in the purple. So something that I realized, and one of my conclusions, being at the Strongsville Family Health Center, was that being understaffed was a significantly large problem. Oftentimes, on heavily booked days, there would be not nearly enough nurses as what required, and there would always be, like the day before, the nurse manager, who was my mentor, she'd be like scurrying to try to call people to come in and work, but obviously sometimes that doesn't work when people have already set up their plans a long time in advance. I also noticed that rotating caregivers weren't that proficient in their new work environment. Some nurses from the main campus would be in the OR, and they'd place things in the wrong spot or use machines incorrectly, and it would need the assistance of techs, or then the cleaning crew would have to take the pillow out before the surgery, and it just led to a plethora of inefficiencies. And I also concluded, transitioning in my recommendations, that effective communication can overcome many of the obstacles in decreasing turnover time. I'd strongly recommend a commitment to cross-training. I know it had been talked about at this particular family health center. I'm sure at other family health centers in the Cleveland Clinic system, but there definitely needs to be a commitment to it, because if everybody's aware of what everyone is doing, not just themselves, it makes the process run a whole lot more smoothly. And they should definitely avoid being understaffed by anticipating these heavily booked days months in advance, instead of waiting maybe a week. And it's not always their fault because they take on cases, but that's something they can just look into a little bit more, trying to anticipate days that could be busier. And then another recommendation is rotating caregivers should be taught a course on how the processes work in each of the given hospitals in the Cleveland Clinic health system. What I mean by that is not just for the Strongsville Family Health Center, but even in Twinsburg, Worcester, just so that they're accustomed to their new work environments, and that they know what they're doing, because a lot of these people do it in the best intentions, but they don't always know what they're doing. So one big recommendation too that I noticed being in the OR and watching some surgeries, and also being with surgical staff when they get back the tools used in the surgeries, was that they're not always on the same page. Scissors, tweezers, and other little equipment like that, they're not always placed correctly for the surgeon. That's always something that they've complained about. And surgical staff, they sometimes get the tools back and it's not how they'd like it disposed. So if they work together, they could probably prevent those problems by just communicating well with each other and finding out their preferences, and it could probably make the process move a whole lot more smoothly too. But overall, the great family-like cohesiveness, which makes the Family Health Center in Strongsville run as efficiently as it does right now, should be there forever. It works great, and everybody's kind, generous with their time, and they're all looking forward to helping patients, and they look for the patient's best interests before their own. I'd like to thank Kim Platt, who was my mentor, Dr. Gupta, who was the head of anesthesiology there too. He was very helpful when I needed data or just had basic questions. George Hinton, who was he was a big member there. He's actually now at Twinsburg, but he was a great help when I had questions for him. All the nurses and all the front desk staff at the Family Health Center, they're very kind. And the surgical staff, they were great to me. And the Cleveland Clinic Civic Education, thanks for this opportunity. And I'd like to thank my peer mentor, Jonathan Harrison.